presentation.
Hi, Colchester families. My name is Moriah McCullagh, and I'm the school nurse at Porters Point School. I'm joined here today with Lindsey Campion, who's one of our school nurses at Colchester High School. Lindsey and I are both new nurses to the district this year, but perhaps even more importantly, we're both parents of students in the Colchester School District. We wanted to introduce ourselves and share with you some information that you'll need to know also about returning to school this fall. I've spent the last 21 years working in both adult and pediatric emergency departments and have been subbing in the Colchester School District for the nurses for the last 6 years. And I'm really excited to be joining the district nursing team this year. And I'll let Lindsey introduce herself.
Yeah, I'm Lindsey Campion, and I have been a nurse for 16 years, and the last 6 years I was a school nurse at St. Albans Town Educational Center. And I'm also really excited to be in Colchester School District and get to know all of your children and families. And now I will start a little slideshow that we put together for you guys with some information that we thought would be helpful.
So to start off, we'd like to introduce you to our district nursing team, who has been hard at work this summer, assisting administration in the planning to reopen schools. So again, I'll be the nurse at Porters Point School. At Union Memorial School, our school nurse is Kathy Kelly. At Mallett's Bay School, we have Josie Lang. Our nurse at Colchester Middle School is Melissa Goldberg. And at the high school, we have Deb Deschamps, who is our district nursing supervisor, and Lindsey Campion, who you just met. As part of the work we've done this summer in preparation for reopening schools, our district nurses have met with pediatric infectious disease specialists, Dr. Lee and Dr. Razka from the University of Vermont Medical Center. And what we learned from the research based on contact tracing and school reopening studies in other countries and regions is very reassuring. So based on our current understanding of the data that's available, the research suggests that children are less likely to become infected with COVID-19. Children are also less likely to develop severe disease if they are infected. Children, particularly younger children under the age of 10, seem less likely to transmit the virus that causes COVID-19. And countries with low COVID-19 prevalence rates, similar to those that we have in Vermont currently, have successfully opened their schools without significant outbreaks of the virus. So this infographic is from the Vermont Department of Health. For our pediatric numbers here in Vermont are consistent with the data from other studies of children around the world, suggesting that children are not the main drivers of this pandemic. This information is from August 25th, so this week. Out of Vermont's 1,500 plus cases, only 57 have been in children between the ages of 0 and 9. And between the ages of 10 and 19, only 158 cases. No Vermont children have been hospitalized due to COVID-19, and there have been no pediatric deaths from COVID-19 in the state of Vermont.
So the steps that are being taken district-wide are all staff have completed a training on COVID-19. There'll be daily health checks for all staff and students. Staff and students will stay home if they're not feeling well. There'll be frequent hand hygiene throughout the day, physical distancing between the students and staff. We'll limit the mixing of students during the school day. We'll be limiting the visitors to our schools and limiting sharing of school materials, and also increasing cleaning and disinfecting of our high-touch surfaces. This is a review of the basics, which are our main goals for this school year. The first is just monitor your symptoms, stay home if you're not feeling well, wear a mask, physical distancing, make sure that the students know that they'll be being 6 feet apart from each other. And we will be washing our hands a lot. Soap and water is the preferred, and then we'll have hand sanitizer for backup. And everybody will be wearing facial coverings. Staff and students are all required to be wearing masks. The ones that we're recommending for students are the cloth facial coverings that you'll see, probably not a coffee filter like this guy's wearing, but there are preferred ones, which we talked about as being the cloth ones. The gaiters are not preferred, but are allowed, and bandana is not preferred. The ones that have valves are not allowed. So that's the mask that has a little hole in it with a valve. We're not allowing those. So just encourage your child to try different masks and find ones that feel good to them so that they're ready to wear it all day. And it's a good idea to send in a few masks with your student. You can put them in a plastic bag and they can keep it in their backpack. And a good idea to label it just so that people aren't losing things. And another little graphic about just how important it is to wear a mask and stay 6 feet apart. We put this in here because it's a little bit of information for younger kids, for parents to help them get used to wearing a mask. If you just explain why, practice, pretend, you can put your mask on stuffed animals, just try and get creative with making masks fun and introducing them to your children.
So we need you to know that any staff members or students who travel to areas that the state of Vermont has deemed a high-risk area must quarantine for up to 2 weeks upon returning back to Vermont. So these students are not allowed to attend in-person instruction while they're quarantining. These areas in this map can be found on the Vermont Department of Health website. They're indicated by yellow and red on the interactive map that's found there, and they're updated every Friday based on the numbers of active cases in those areas. So we'd like you to pay attention to that as you plan travel. We're asking every family to do their part in helping to keep our school community healthy. We know mornings are hectic. Lindsey and I are also going to be trying to get our kids and ourselves out the door and everyone ready for the day. However, each morning before in-person learning, we'd like you to consider these 2 questions as part of your new morning routine. So 1, has your child been in close contact with anyone who has been diagnosed with COVID-19? And close contact, for the purpose of this question, is defined as within 6 feet of a person with COVID-19 for more than 15 minutes. And the second question is, has your child been unwell with any symptoms of COVID-19? And these symptoms include cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, headaches, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea, or a new loss of taste or smell. And if your child has had any of these symptoms, even if you feel that they are mild, we're asking that they stay home for the day. When you send your child out the door, either to go to school, to walk, to bike, or to catch the bus, you're certifying that when your child leaves the house that they do not have an elevated temperature and that they are well and ready for the day. When they arrive at school by car, foot, or bike, they will be asked these questions by staff and they will have their temperature checked. If your student arrives to school by bus, we're asking that you wait with the student at the bus stop if at all possible. Several precautions are also going to be happening on the bus. In addition to a regular cleaning schedule, windows are going to be kept open, so make sure your child is dressed appropriately for our cooler fall weather. Students will be wearing masks on the bus and will be spaced apart from one another as much as possible. Siblings will be allowed to sit together. Upon boarding the bus, they're going to have their temperature checked using a no-touched hand thermometer. If they should register a fever at that time, we would ask that you take them home. If there's not an adult at the bus stop and the child has a fever, the student will be transported by bus to the school. They will be seated by themselves in the front of the bus, remain masked, and the windows will stay opened, and they will report directly to the medical waiting room to meet the school nurse upon their arrival. In this case, we ask that you pick up your student within 30 minutes and have a backup plan in the event that you are not available for pickup.
So if your student gets sick during the day with any of the symptoms of COVID-19, they'll be transported to the isolation or isolation room, or medical waiting room that we're calling it, and we've given them some extra fun names. If their symptoms are life-threatening, we would activate EMS, but for the non-life-threatening symptoms, the nurse will assess them in the medical waiting room, and we'll be following a algorithm that the Vermont Department of Health has put out, letting us know what advice we should give to students about when they will be able to return to school. And the big takeaway from this is that it's really, really important to have your contact information up to date, like we just mentioned. We will be calling home first and sending students home way more than we would have in the past. I'm just going to move us up here so you can see, but this is an example of one of the medical waiting rooms. This is me wearing all my professional or PPE that I will be wearing in our medical waiting room, which is at CHS is going to be called the Laker Lounge. And this is a picture of what it looks like. And it has a door to the outside so that when you pick up your student, you can just drive right up. There'll be signage outside showing where to go, and the student can leave right from this room. And there's a couple other fun names: the Cougar's Den, Osprey Room, Champ's Chill Zone, and the Panda Room. This is the algorithm that we're going to be going by to give advice on when students can come back to school after they've gone home with any of the COVID symptoms.
Okay, so let's run through a couple of scenarios. Lindsey, I have two daughters who are going to be at the high school this year. Go Lakers. If one of them develops a cough while they're at school and then comes down to see you and is found to have a fever, what will happen?
So we will be assessing them in our isolation room, the Laker Lounge. And if they do have COVID symptoms, we will be calling the parent to pick them up and suggesting that the family check in with their primary care physician to see if a COVID-19 test is recommended. If the test is negative and there's been no exposure to COVID-19, to a COVID-19 positive patient, the student can return to school when their symptoms have improved and they've been fever-free for at least 24 hours without the use of fever-reducing medicine. If the test is positive, the student can return to school after 10 days have passed since the symptoms first appeared, and they have been fever-free for at least 24 hours without the use of fever-reducing medicines. And so I have a question for you, since my son is a first grader. What if he developed a runny nose at home and has not been exposed to anybody with COVID and hasn't had any high-risk travel?
So in this case, we would say that your son stays home from school for the day. Siblings and you would be allowed to attend school as long as you don't have symptoms also. Assuming that while he's home, he doesn't develop a fever, because this would change the algorithm a bit, he'd be allowed to return to school after 24 hours if he was feeling better and his symptoms had resolved.
And just another reminder that if a student shows any signs of COVID-19, they will be sent home. So definitely make sure that you have those backup numbers ready and plan in place for if this happens, because we will be asking that you pick up your student within 30 minutes.
There's a few other changes for this school year we want you to be aware of. So first, there will be no sharing of food allowed and no outside food brought in for celebrations like holidays or birthdays this year. Visitors to the school will be limited, and in most cases, we will try to schedule parent meetings virtually or over the phone. And our playgrounds are also closed for the time being. We have a couple of medication reminders. If your student will need medications during the school day or have emergency medications like an EpiPen or inhaler, we ask that you contact your school nurse and set up a time to drop off these medications prior to the first day of school. We will need a doctor's order signed by both your child's physician and you in order to give those medications at school. These forms are available on the district website or can be obtained by contacting your school nurse, and we'll point you in the right direction to them. Please also send in your allergy, seizure, or asthma action plans if these conditions pertain to your students. And for students with asthma, we are asking that inhalers come with spacers this year.
Here's just a little thing that we put together for 10 things that you can do to prepare for returning to school. So we've talked about some of them, but number one, practice that hand hygiene, practice putting on your mask, practice the 6 feet of distancing. It'd be a good idea to have a thermometer so you can check your child's temperature in the morning so that you make sure that when you send your student out to the bus stop that they don't have a fever, so you're limiting them getting turned back away. Make sure to have extra masks and try on different kind of masks. Number 6, update your immunizations. This is business as usual. Students will need their immunizations that they normally would need for school. And then we talked about changing the inhaler to have a spacer, and bring in a water bottle since our water fountains will be closed. And we talked a lot about this one, but make sure that your contacts are up to date. And then last, we just put stay informed, educate yourself from reliable sources like the CDC or Vermont Department of Health and the Colchester School District website. And just remember that we're in this together and keep smiling. Stuff is always changing, but we're gonna get through this together. And we recognize that this pandemic has been so difficult on many of our families, and there are community resources that are helpful. So we just put together a few of these, and you could always push pause on your video to get these numbers. But the CDC has good resources, the American Academy of Child and Adolescent Psychiatry, the Vermont Department of Health, Steps to End Domestic Violence has the number here, the Howard Center, which has a crisis line, Colchester Food Shelf, if you need help with that, the United Way helpline, and then helpmegrowvermont.org can connect your family to critical resources. And of course, you can always call any of your nurses with questions. These are our emails here and our phone numbers. And we are here to help you guys get through this. And we hope that this was helpful for you. And we're so excited to welcome back your students.